Well, March 30th marks National Doctors Day. It's a great time to recognize the dedication of our physicians who care for our communities each and every day. So joining me now to talk about the importance of Doctors Day and how the industry has evolved over the years is Lisa Trumble. She is the CEO of SoNE Health. Great to have you here.
Thank you for having me, Bridget.
Thanks for talking about this.
This is an important day.
And from your perspective, what is the meaning behind this day that you want people to know?
I want people to know about this day is it's a time to celebrate the caregivers, our doctors that are at our bedside, take care of us during difficult times in our life, or even, in the happier times of our lives, right? The person that's there when you need them the most, when you're having an illness or a life experience, the birth of a child.
Right,
is
that's a happy
a lot
time.
of times a doctor, right? And they're not recognized as much these days, and they're marginalized in the healthcare industry. And Doctors Day is a way to celebrate their dedication to taking care of people and delivering wonderful health every day and improving our outcomes.
And the field, as we've heard, has changed a lot over the years. It has evolved. What are some of the challenges that most people might not see?
I think one of the biggest challenges that doctors face is the barrage of administrative bureaucracy in their practices. Our doctors want to spend their time, they went to school to take care of patients, to take care of people, to deliver excellent clinical care every day. They didn't go to school to be an administrator, to push paperwork, to spend most of their day writing notes and documenting everything that they're doing during the course. It's tedious, right? And but they want to deliver care. They want to take care of you. They want to understand what's wrong with you and help you. And that administrative burden takes away from the clinical time and the dedication to their clinical work in a way that's actually expanded their workday in unreasonable ways.
Doctors talk a lot about burnout that comes with the job, especially since the COVID-19 pandemic. How do health networks like yours, SoNE Health, support doctors in the best way possible so they can continue delivering that top quality care?
I think it's an excellent question. Certainly, the industry has changed a lot. Everybody's complaining about healthcare costs, right? And doctors are in front and center in the business of trying to improve the cost of healthcare too. Right. And what we help them do is organize the administrative work in a different fashion so that they can spend more time delivering care to their patients by having the support of other clinical providers around them, like nurse practitioners and nurses and social workers and behavioral health folks. And we help them do that. We also take the burden of tedious things like payer contracting off their backs so that they can run their practice. And we provide administrative support to help them reduce the operating costs of their practice.
That's so important.
It's so important because nowadays more and more providers are moving to an employed model rather than staying independent. And it's really important as patients that we have independent providers in our community because we want to know that the people that are advising us on our healthcare are being non-biased in their advice of the healthcare.
It really is such a critical point. On the flip side, let's talk about the rewarding nature of the job. What makes people want to be a doctor?
I think it's the passion for improving health outcomes and working with people. If you don't like working with people, you probably shouldn't be a doctor, right? Let's just
choose something else.
Working with people and improving their clinical outcomes, caring about the fact that we know how to make people better. We know how to avoid a lot of the conditions that our patients are developing, and they want to be able to impact that. The positive impact, the humanity associated with it, which we think has been stripped out of healthcare, by and large over the last couple of decades. And, that relationship of building a relationship with a patient over time, over their life, and watching them evolve, I think is the passion that drives someone to go into medicine.
They're the heroes among us, the
Absolutely.
unsung heroes, to say the least. For those watching us right now, they want to express their gratitude, say thank you to a doctor. What's the best way to do that?
When you're in the office with them, thank them. When you see them in an ER, when you see them on the street in your community, because they're part of the community too. Thank them for the time and the dedication and for helping you. And just the words thank you, I think, go a long way.
Because the hours are long.
They're long.
And the job is stressful.
It is very
I can
stressful.
Imagine.
Very stressful. Very stressful.
Lisa Trumble, thank you so much for
Bridget,
coming
thank
on.
you so much.
Really appreciate
I appreciate
the
the
SoNE
time.
Health, and definitely thank a doctor today. So important.